Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwonka. First, the highlights. Nigeria witnessing a rise in coronavirus cases as the NCDC expands testing centers to 21. Nigeria Center for Disease Control delegates to Kogi State flee from isolation after government insisted on having them self-isolate for 14 days. United Nations Secretary General warns against coronavirus-inspired racism. Welcome everyone to the program. Now, Nigeria is experiencing a jump in COVID-19 following the ease of lockdown by the president in the Federal Capital Territory, Lagos and Ogun states, which has not left out the other ease of restriction by state governments across the country. While the NCDC has tested over 22,000 people with a testing capacity per day of over 1,500, according to the Presidential Task Force, the committee aims to increase that capacity to 2 million in 3 months, each state government having the capacity to test at least 50,000 people. So what is the impact in the rise of COVID-19 patients? What will it have on the polity, bearing in mind that we are witnessing more infections among the productive class? Well, that's our theme. Later this afternoon, we'll be taking a closer look at that. 381 new cases, one of the highest in a single day since the coronavirus broke out in Nigeria, is what the Nigeria Center for Disease Control has confirmed in Nigeria, bringing the total number of infections in the country to 3,526. The center also announced that 601 patients have been discharged, a total of 107 deaths recorded. Of the 381 new cases, 183 are in Lagos, 55 in Kano, 44 in Jigawa, 19 each in Zamfara and Bauchi states, 11 in Katsina, 9 in Borno, 8 in Kwara, 7 in Kaduna. Gombe has 6, 5 in Ogun, 4 in Sokoto, 3 each in Oyo, Rivers, 2 in Niger, 1 in Akwa Ibom, 1 as well in Enugu, and another 1 in Plateau states. The nation's commercial capital, Lagos, remains the epicenter of the pandemic, with a total of 1,491 cases, followed by Kano, Northwest, with 482 cases. The FCT did not record any new case yesterday, but has the highest infections in the North Central, while Borno has highest figures in the Northeast, with 125 cases. Edo still leads in the South-South with 65 cases, followed by Enugu in the Southeast, with 9 cases, although the latter states did not record new cases as of yesterday. Now, office holders in Nasarawa State have unanimously agreed to donate 50% of their salaries for 3 months. This is to fight the COVID-19 pandemic. The decision, which is to take effect from the month of June, was reached at an executive council meeting in Lafia, the state capital. This followed a 10 million naira donation by Governor Abdullahi Sule to the State Committee on COVID-19. Governor Yahaya Bello of Kogi State has ordered the delegation of the Rapid Response Team of the National Center for Disease Control (NCDC), who arrived the state to ascertain the true status of the Kogi State as a COVID-19 free state, to be quarantined at the state's isolation center for 14 days before they can take the sample of any resident of the state. The governor gave the order in the government house, Lokoja, where he said the steps are strictly in adherence to the laid-down procedures of checkmating the scourge by the NCDC and the World Health Organization. However, we're told that the officials, the delegates of the NCDC, have since fled for fear of being detained at the state's isolation center. And even though the NCDC confirmed 55 new positive cases in Kano State, 16 more COVID-19 patients have been discharged from its facilities after they tested negative twice for the virus. A statement signed by the Commissioner for Information, Mr. Mohammed Garba, So the total number of discharged patients in the state now stands at 22. He said among the discharged patients were Professor Abdulrazak Habib, the Department of Medicine, Aminu Kano Teaching Hospital, Bayero University, Kano, who's also the co-chair State Task Force on COVID-19, Dr. Aminu Sayawa, the state's Commissioner for Health, among others. The commissioner pointed out that all the patients have tested negative for the disease after follow-up tests. He advised the public to continue to observe the strictest personal hygiene through regular hand washing, use of face masks and social distancing. To the south, where the River State COVID-19 local government task force have been instructed by the governor to identify hotels still operating during the lockdown for the state government to demolish them. The River State Governor, Nyesom Wike, while inaugurating the state's COVID-19 task force at the Government House, Port Harcourt, also charged them to identify airing beer parlours. The governor said the task force must be decisive to ensure that coronavirus is not accommodated in River State. And indeed, what are the ways that we can stem the tide of COVID-19? Joining us on the program is Dr. Gregory Oyihoyi. He is the Deputy Director, Research, Nigerian Institute of Medical Research, Head Infection Control and Biosecurity. He's also a foremost consultant, obstetrician and gynecologist in Nigeria. He joins us on the program. Glad to have you.
Good to be here, Millicent.
All right. Tell us about drive-through testing. We've heard about that. One of your colleagues who was here yesterday, and she talked about it. How is that progressing?
Well, great. It's one of the things that the Nigerian Institute of Medical Research is doing to help with the response to the COVID-19 pandemic. And the beauty of the drive-through testing strategy is such that it's helping to upscale the number of patients who will be tested. It's also helping to reduce the spread of infection because of its uniqueness. And it says that for those that drive through, they are kept inside their car, while those that the pet personnel that will collect their samples are outside. So it tends to reduce the spread of infection. The beauty of what we've also done at the Institute is that we've also modified it to allow those who don't have the luxury of their own personal cars to walk through and also get tested.
So a walk-in.
Yes. So they walk into the center, they go through the process, and they get tested. And you can do a large number of cases at a time. And patients who are not so ill can benefit from this and have this option. And it's completely free.
Especially for those that have been told that might be asymptomatic.
Exactly. Asymptomatic patients, those with mild symptoms, they can go through this modality of testing.
Are you alarmed by the number of cases we're seeing of COVID-19 in Nigeria?
Well, not really, Millicent, for the following reasons. One, we are doing more testing, so we're going to get more cases. And even at that, we are not doing enough. We are still under 23,000 tests. And if you compare that to some other nations of the world, you know we are still far behind for our population size also. And if you also look at the fact that for our population size, we are not reporting as many cases as those who have similar populations. So there's something wrong with testing. We still need to do better in that regard. So as we do more tests, we are going to get more cases. That's one. Two, we are also going through the phase where the disease is already in the community. We're having community spread. And the recent lockdown has been eased off. So that's going to, in a way, facilitate more community spread. So I'm not surprised we are getting more cases.
Tell us about some of the perhaps age range that we're seeing. We're having most of our productive young people who are getting caught up in the virus, and we're also witnessing a lot more children that are involved now. In terms of the signs and symptoms of COVID-19, how does it differ? Because it appears we're having more and more symptoms each day.
Yes, that's not unexpected for a new disease that you are still trying to understand the cause of the disease. So you are going to have a situation where the exact symptom manifestation is not so clear. And one thing about COVID-19 is the heterogeneity of symptoms. You know, there are cases that have been reported of young people who are coming down with cerebrovascular accidents known as stroke. You know, there are cases of young children, particularly among the Caucasian population, they're having a purplish feet. And that's likely due to inflammation of the vessels, what we refer to as vasculitis. So the lesson for this is that clinicians should be aware. Every patient that comes into your clinical care, you have to watch out for symptoms that may not be conventional COVID-19 symptoms. I have a colleague of mine who was recently isolated because he managed the patient that was supposed to be a cardiac condition from one of the public hospitals and realized later the patient had COVID-19. So people should be aware of any symptom that come across their path, particularly those who work in the public hospitals, those who work in private hospitals. So atypical symptoms, atypical presentation that are not conventional should ring the alarm bells. You know, if you have a young person who is having features consistent with a stroke, you have to investigate further. If you have used your conventional modality of management, you know, for instance, you have a cardiac patient and you use a conventional modality of management, you're not getting the right result. You should think of COVID-19. So we should have a low threshold for diagnosis. So I think that's the clinical lesson to learn from the highly heterogeneous pattern of presentation of this condition.
Tell us about the pregnant women, this vulnerable group in this stage. We heard that Jigawa, for example, recorded a loss in the isolation center, a woman said to have miscarried and then died as well. How does COVID-19 affect the woman, and perhaps in terms of managing a pregnant woman that has COVID-19?
The general rule about pregnancy is that in pregnancy, the immunity is not as good as in non-pregnant state. So pregnant women generally have a reduced immunity. So they have increased predisposition to disease condition, and COVID-19 is not an exception. That's one. Two, if a pregnant woman comes down with COVID-19, it's going to run an aggressive course. You know, it's not going to be like the conventional case because, again, the immunity is also low. But what we've seen so far in women who have delivered, pregnant women with COVID-19, that who have delivered babies, we've not seen cases of mother-to-child transmission in the babies. That's one good news we've not seen. But we've also seen that mortality is higher because there's a case that was reported, in the U.S. where, the woman delivered, but she didn't make it at the end of the day. I think the lesson is that for pregnant women at this point in time, we should be careful in their care. They should protect themselves. Then by other worries, the collaterals of it, some women who are pregnant, they are scared of going to the hospital when they ever have complaints or symptoms or complications because they feel as if the hospital is not a dangerous zone for them.
Indeed.
Then the managers, the clinicians who are managing the pregnant women, they're also apprehensive, they are careful because, during the process of conducting delivery for a pregnant woman, you're exposed to a lot of body fluid, liquor, blood, and all of that. So you're also worried about that. So there's this apprehension on both sides. And the lesson to take from it is that, one, pregnant women should go through extra vigilance to protect themselves because the disease runs a very aggressive course in them. Two, pregnant women should have a low threshold to present to the hospital irrespective of the era of COVID-19. Three, clinicians should not reduce the quality of care they give to the pregnant women irrespective of COVID-19. What they should observe is universal precaution. Every patient you are seeing, you should don your personal protective equipment correctly because you don't tell what that patient will have at the end of the day. So not that in retrospect you begin to feel as if maybe I could have protected myself better. You should assume that every patient you are seeing has a tendency to have COVID-19 and you should protect yourself. And even the patient should protect themselves against the doctor because, we don't do daily testing for our clinicians or our caregivers. I think that's the way to go about that.
A lot of precautionary measures there. Thank you so much, Dr. Gregory Ohihoi, Deputy Director of Research, Nigerian Institute of Medical Research. Thank you for joining us on the program.
My pleasure. Thank you, Millicent.
Still to come on our COVID-19 update, how do we stop the anti-foreigner sentiment that is surging as a result of the pandemic? We have that story and more when we return. Welcome back. And from across the states, the federal government of Nigeria has identified the poorest of the poor in some communities of Calabar municipality. This is to validate and capture each person's in the YESO register in order for government to provide them with palliatives following the aftermath of COVID-19. The visit, according to representatives of the federal government, is followed by a directive by the president that the Youth Employment and Social Support Operation register be validated and expanded to extend to capture more of the group in society. Now, a 9-year-old child, the contact of the fourth case reported in Enugu State, who had tested positive, travel history has been confirmed to have the coronavirus. The patient has been admitted into one of the state's isolation and treatment centers, with further contacts being identified, necessary samples taken for testing. According to the government, decontamination of the patient's home has been promptly carried out. The government is reminding the people of Enugu State to stay at home and only go out when absolutely necessary. Now, the Ebonyi State government is set to activate its screening centers across the state to curb the spread of the coronavirus in the state. The state governor, Mr. Dave Umahi, made this known during the State Security Council meeting at the Government House, Abakaliki, the state capital. He explained that the activation of the screening centers in all the 13 local government areas of the state will prevent people who have, in one way or the other, smuggled themselves into the state through the local communities. Well, let's find out what's happening in the United Kingdom. We have Dr. Iyala Douglas-Pepple, GP Registrar, Queen Elizabeth Hospital, Norfolk, England. He joins us via Skype. Thank you so much for joining us at this time. I see that you appear to be at work. Tell us about the front lines in the UK today.
Thank you, Millicent. It's a pleasure to be here today. So basically, we are also in the fight against COVID-19. And so far, I think the UK is experiencing honeymoon period, I would say. Things seem to be in the decline in terms of number of new cases and in terms of the death rate as well. So it looks like we've gotten to the peak and we're gradually sloping downwards. And that's why the government is looking at possible measures to put in place to relax the lockdown so that economic activities and life can gradually return back to normalcy.
We hear that there's a study in the UK suggesting that black people are twice likely to die after contracting the coronavirus as white people. What do you make of that study?
Yeah, so it's not typically just black people. It's the black and minority ethnic groups. So talking about black people, Afro-Caribbeans, the Asians, and all of that. We know that the NHS is about 70 years old. About 71 countries are represented in the NHS. And the BEM communities form about 1/3 of this workforce. So you can imagine when you expose this kind of you have this large number of people working in a particular sector, the risk of them being worse hit by whatever comes around is going to be high. The disproportionate high number of BEM community members who have died from the NHS has warranted a lot of research and discussion in the both in the public and in the health sector. So far, about 64 people of BEM extraction have died, with the Philippines having about 19 of them. 4 Nigerians so far have been reported dead, and 2 of them are actually from Rivers State. So this causes for kind of concern. There's been a lot of argument and discussions about what should be or what are the predisposing factors to this. And the one that has been put across mostly is socio-economic deprivation, and also the argument between genetic code and postcode. So for postcode, we know that rich people tend to live in some specific type of postcode. Postcode in the UK determine area or mapping or location where you live. And the genetic code is something quite questionable as well. What is it in the genetic code of black and ethnic minority groups that predisposes them to being worse hit by this? And discussions are still ongoing. And we know that for now, there's nothing conclusive anyways, but measures are being put in place because of this awareness by the NHS to ensure that the BEM community members of the NHS are protected. For instance, in the places where some of the hospitals, even where I work, BEM members are advised not to ever see any patient without having full PPE. So that's one of the measures that are being put in place. The government also is trying to cushion the effect of this death on the family members. The government has put in place measures like a financial reward of £60,000 for members of family members who've lost their family members to COVID-19 from BEM community, and also granting of indefinite leave to remain to family members, to dependents of those who have also lost their lives in the fight against COVID-19.
All right, that's a lot of great package there. But quickly now, the Prime Minister said governments will proceed on the ease of lockdown with maximum caution. Do you think the UK is ready?
Personally, I think that is a good step in the right direction, because if we put some measures in place which the government is trying to do. First of all, what I think is informing this decision is from what the national mathematician has said, Professor Ian Diamond. It's been put across that the reproduction rate for the coronavirus in the UK is now about 0.5 to 0.9%. What that means is reproduction rate basically is the rate at which the virus can infect another person. So now it is less than 1, meaning that whoever has the virus has less than 1 chance of transmitting the virus to another person. So that is quite a positive, step in the right direction. So we're looking at this, then there is no other reasonable thing to do than to start relaxing the lockdown. And the measures put in place to relax the lockdown by extra precautions is quite commendable. The government is trying to develop an app which should be operational from mid-May, which is the month we are in now, to track and test people who are suspected to have COVID-19. So if we embark on massive testing, tracking, and tracing for people who've got symptoms of coronavirus so that we get them on time and they self-isolate, then the essence of the lockdown will have been properly achieved.
All right, Dr. Yala Douglas Pepper, GP Registrar, Queen Elizabeth Hospital, England. We appreciate your time. Thank you for talking to us. Continue to stay safe.
Thank you very much.
Now, the United Nations Secretary General Antonio Guterres had called for an all-out effort to end hate speech globally. He said the coronavirus pandemic had unleashed a tsunami of hate and xenophobia. Anti-foreigner sentiment has surged online and in the streets. He said anti-Semitic conspiracy theories have spread and COVID-19 related anti-Muslim attacks have also occurred. He did not, however, give any specific examples, but let's take a look at some of the areas, some of the recent incidents where this has been reported.
Migrants and refugees have been vilified as a source of the virus. And then
the United Nations Secretary General Antonio Guterres is calling for an all-out effort to end rising racism linked to the coronavirus pandemic. He says the pandemic continues to unleash a tsunami of hate and xenophobia, appealing for an end to hate speech globally.
We must act now to strengthen the immunity of our societies against the virus of hate. That is why I'm appealing today for an all-out effort to end hate speech globally.
Meanwhile, the World Health Organization says the coronavirus could kill up to 190,000 people in Africa in the first year if the control measures fail to work. The organization cites a new study warning the numbers would overwhelm the available medical capacity in much of the continent. Across Europe, leaders are marking the 75th anniversary of V-Day with low-key ceremonies as much of the continent remains on the coronavirus lockdown. Australia says it will ease social distancing restrictions implemented to slow the spread of COVID-19 in a 3-step process with the aim of removing all curbs by July.
We move ahead with reopening our economy and our society with a clear plan and a clear framework that shows Australians the road ahead.
And as the world begins to ease lockdowns, social distancing signs around the globe shows the new normal citizens have to adapt to.
Take responsibility in protecting your health. That's the message from the Nigeria Center for Disease Control. Its website has live updates on ways that you can practice physical distancing and also stay at home if you feel unwell. Call your state's hotline. Of course, it said there's no religious or social gatherings. Banks, corporate offices can open 8 a.m. to 2 p.m. Government offices, Monday, Wednesdays, Fridays, 8 a.m. to 2 p.m. There's a lot of information and statistics on the COVID-19 pandemic on the website also. The World Health Organization has rolling updates on the pandemic strategies and plans. Each moment is updating the number of cases, the number of deaths, and the recovery efforts across the board. That's our COVID-19 update at this time. Thank you for watching. I'm Millicent Walker. Another update comes your way again at 6 p.m. Stay safe. Bye for now.